Well, good morning, Jagender Rana here. So, topic for our discussion today is India's dental ecosystem. India's dental ecosystem. The universal health coverage is one of the major milestones India and many nations of the world has targeted to achieve by 2030. A universal health coverage means that all people have access to the full range of quality health services they need, when and where they need them, without financial hardship. India has mixed economy on healthcare services. The proportion of the population that face catastrophic levels of health expenditure has increased continuously since 2000. So this global pattern is consistent across all regions and a majority of countries including India. So to address affordability, the Indian government spends a mere 2.1% of GDP on healthcare compared to 9.7% across OECD countries, with more than half 55% of healthcare expenditure coming out from the pocket of citizens. Now, public-private partnership have been the mainstays of health reforms in India and continues to be the integral part of India's healthcare system. The public sector brings infrastructure, regulation, and reach, while the private sector offers innovation, technology, and operational efficiency. Over the past decade, because of strong policy support and institutional reforms, India has made significant strides by creation of the PPP Appraisal Committee. This helped to streamline project approvals, enhance transparency, and encourage bidding. In 2021, India attracted US $7.7 billion across 25 PPP projects, which is highest in South Asia. Now, making a 49% increase in private investment commitments compared to 2020. Now, COVID-19 pandemic also acted as a catalyst for accelerating the adoption of partnerships in the form of emerging trends of telemedicine and data-driven decision making. So the pandemic has shown that public-private partnership can bring quality and affordability in healthcare. As investments grows, it is crucial that PPPs are tailored to local needs and designed for practical, measurable outcomes to ensure long-term success and impact. The strategic use the strategic use of public capital and private investments can attract high impact investments into healthcare. Though over 4,300 startups are registered in India's health tech space, very few scale successfully due to regulatory bottlenecks, lack of risk capital, and limited market access. Public-private partnership brings convergence of private sector interests and public sector goals. It intends to optimally utilize and enable increased access to healthcare. So, a partnership model may help to bring healthcare expertise at publicly accessible healthcare centers. India is in very paradoxical situation where approximately 32,000 dentists gradually every year in India. 32,000 dentists graduate every year in India. So while our rural population is underserved, these dental graduates struggle to find stable employment. PPP model can provide huge job opportunities for these young graduates while optimally utilizing the resources to combat huge burden of dental diseases in India. So the dental insurance is another major challenge. Most of the dental services are not covered under any insurance package, and hence dental procedures are perceived expensive and elective. The PPP collaboration can help to create more structured dental market where costs are predictable and care is standardized. Private sectors can build platforms which can support health missions digitally by offering remote consultation, virtual screening, can make oral care accessible in remote locations. The Indian government has been struggling to provide essential oral health care services to vast population, but the focus is shifting gradually. The dental sector is evolving rapidly, driven by technological advancements, shifting practice models, and increasing public awareness. Looking ahead, investment in accessibility and innovation will continue to shape the future of oral healthcare in India. So ensuring better outcomes for patients while fostering industry growth. In the coming years, to fulfill universal health coverage, a well-regulated public-private partnership model can address both the supply and demand challenges of current healthcare system. The synergy can be harnessed to bring evolution in infrastructure insurance, innovation and employment. PPP model can overcome limitations of either sector alone. Together, this collaborative approach can help realize the vision of universal health coverage by 2030, one healthy smile at a time. Now it will be amazing when well-intentioned and motivated organizations and individuals can come together and accomplish the nation's vision for optimal oral health for all by 2020 rather. So together in public-private partnership, the private sector plays a significant role in delivering oral health care to people, where government cannot fully meet the oral health needs of the people with public resources alone. However, the private sector cannot be replacement for the effective public sector. Both sectors have roles to play in addressing the complex and difficult challenges faced by developing countries like India to expand access to high priority oral health services to underserved populations. The public-private partnerships are a unique call for action effort of developing a framework that addresses disparities in the healthcare delivery and access to care in communities around the nation. These partnerships blend political, economic, and social forces to raise awareness of the oral health needs, to understand population, and to provide inspiration for a public consciousness. So, effective public-private partnership operates on a system of shared values, purpose, and accountability. So the collective and complementary talents of private health agencies, private industry, NGOs, non-profit organizations, healthcare providers, educators, media, community leaders, and concerned citizens are important to eliminate health disparities of the country. Now, the private sector and public sector each has unique characteristics and strengths. Linking the two can result in a creative synergy, capitalizing on the talent and resources of each partner. In addition, efforts are needed within each sector to increase the capacity for program. So the development for building partnership and for leveraging programs. So a sustained effort is needed right now to build the nation's oral health infrastructure to ensure that all sectors of society, the public, private practitioners and government personnel have sufficient knowledge, expertise and resources to design, implement, and monitor oral health programs. So, programs that affect oral and general health, such as tobacco control, diet counseling, health education aimed at pregnant women and now mothers and new mothers, and support for use of oral facial protection for sports can benefit from collaborating among public health and healthcare practicing communities. Successful partnering at all levels of society will require efforts to strengthen the networking capacity of individuals and communities to address their oral health needs. Build and nurture broad-based coalitions that incorporate views and expertise of all stakeholders and that are tailored to specific populations, conditions, or programs. Strengthen collaborations among dental, medical, and public health communities for research, education, care, delivery, and policy development. Then develop partnerships that are community based, cross disciplinary, and culturally sensitive. Work with the partnership network and other coalitions to address the four actions previously described, like change perceptions, overcome barriers, build balanced science base, and increase oral health workforce diversity, capacity, and flexibility. So, the vision for optimal oral health for all, acknowledging oral health is a fundamental part of general health and well-being. To be passionate in promoting oral health, eliminate oral health disparities, and improve quality of life. Private-public partnership is must as a force to enhance the nation's overall health and well-being. So, the Indian Dental Association affirms that oral health is essential to general health and well-being, and thus the need to take action by calling for private-public partnership. It aims that nobody suffers from the oral diseases which can be prevented and treated. Young children do not suffer from caries. Rural population do not experience poor oral health due to barriers to access to care, shortage of resources and professionals. So, Dental Association therefore calls for private-public participation to accurately identify the needs, monitors outcomes, decreases disparities, improve access to care, and ultimately improves oral health. Thank you. Thank you very much.